Hi, everyone. Thank you for joining us today. I am thrilled to say that I'm here today with Dr. Bradley Bale, one of the co-founders of the BaleDoneen Method. And thank you, Dr. Bale, for joining us today.
Oh, thank you for having me on. Yeah, it's going to be fun.
It's going to be fun. So everyone wants to know more about Dr. Bale and the history of the BaleDoneen Method. Everywhere we go, I get asked questions about you personally and about, as I've stated, the history. How did this most powerful prevention program come to be? And so for those who haven't heard of the BaleDoneen Method, I just want to say that the BaleDoneen Method is the most powerful and effective heart attack and stroke prevention program. In fact, it's a cardiovascular disease treatment, management, and prevention program. And you want to know more about it because heart attack and strokes are still the #1 killer and the #1 cause of disability in the United States and worldwide. But we're making headway on that. But I want you to know about the book that Dr. Bradley Bale and Dr. Amy Doneen co-authored together, Beat the Heart Attack Gene. This book was published in 2014, and a revision will be coming out hopefully this year, next year at the latest. But the content of the book is still very relevant today. You can get a copy of this book on Amazon, and you can get it in all formats, Kindle, Audible, and you want to read this book. You can see mine is still well used. Patients call me all the time wanting information, and I'll send them to such and such page in the book to learn more about how to live your life free of heart attack and stroke. But let me just tell you that Dr. Bradley Bale holds professorships. He's an adjunct professor at Texas Tech Health Sciences Center in Lubbock, Texas. He's the clinical associate professor at WSU College of Medicine. He's assistant professor at University of Kentucky College of Dentistry, which is very important and key as dentistry and medicine are coming together in this heart attack and stroke prevention program. And Dr. Bale runs his private practice in Gallatin, Tennessee, which is just north of Nashville. He also runs his private practice in Lubbock, Texas, where he's been for years, and we'll talk more about that. And he is one of the nation's leading specialists in preventing heart attacks, strokes, and diabetes. And we know more and more now about the program preventing dementia as well. All chronic diseases really are driven by inflammation, and Dr. Bale has been preaching that message for years, that inflammation really is the driver of chronic disease. So he co-founded the BaleDoneen Method, as I just said, with Dr. Amy Doneen in 2001, and their holistic personalized approach of cardiovascular risk reduction has been effective enough to allow them to guarantee their work to their practices, to their patients. So the results of their method demonstrating regression and stabilization of arterial disease. So I hope you caught that. Their method is published work establishing that this method regresses, stabilizes, and just arrests the disease process in its tracks. And this has been published in peer-reviewed journals. So Dr. Bale, I've said we're just thrilled that you're with us today. And of course, this is going to be one of our first 2 kickoff podcasts and YouTube videos introducing you and Dr. Doneen, our leaders.
Okay, well, thank you. I appreciate you putting this together, and I think your podcast is going to be well received, and we'll look forward to a whole series of podcasts from you coming up. So
yes.
Thanks for having me on.
You're welcome. Thank you for setting aside the time. So let's start with, of course, we're anxious to dive into the BaleDoneen Method. We could talk all day about the science. There's just so many topics, but the purpose of today's podcast is to get to know you more. And we want to start with I know this subject, we just talked about it earlier, heart attack and stroke prevention is really our favorite subject, except for the first loves of our lives, and that's our family. So just tell us about your family, if you will.
Right, yeah. I've been blessed to have a very supportive wife in all these endeavors, Pam, and we'll be married 50 years coming up next year. So it's been a long, good marriage, and we have 3 healthy children. Our oldest son, Forrest, is in Russellville, Arkansas. He's an oral surgeon. Our next child, Brittany, is in Gallatin, Hendersonville, Tennessee, close to where we live, and that's why we moved up there, because she blessed us with 3 granddaughters that we get to see frequently. And she also is my nurse. She was an advanced cardiac nurse at Vanderbilt, when we moved up to Tennessee, and I was able to steal her away from Vanderbilt, which was wonderful because she'd worked with heart attack patients for quite a few years and was a little discouraged because she knew what Dr. Doneen and I were doing to stop the disease. And at Vanderbilt, it's a typical cardiology setting where it's a revolving door. And she'd been there long enough. In her locker, she actually had the names of some patients, their spouses, their pets, because she knew it was just a matter of time till they came back in. So it wasn't too hard for me to steal her away, and blessed to have her as my nurse. And then our youngest son, Jacob, he's out in Spokane, Washington, which is where we raised our family. And he got his PhD in biological genetic engineering. He's already had publications in Nature and Science, and he actually has been on the front cover of Science because he invented a protein cage that doesn't exist in nature and is now being utilized for all sorts of things, including stabilization of vaccines that can be shipped all over the world. And he's given us 2 grandsons, and Forrest gave us 2 grandsons. So we have 7 grandchildren now.
And that happened quickly, like in the last.
Yeah, right. Yeah, the oldest are just 6. Brittany's 2 twin daughters are the oldest, and they're 6 now. So yeah, we gathered up 7 grandchildren pretty quickly, and we may even get some more. But we're always looking at the calendar to see when we can travel off to Arkansas or Spokane to see the grandsons.
Yeah. Well, that's great. Wow. And 50 years of marriage is just really to be celebrated for sure. That's not very common these days. So congratulations.
Yeah, I think the secret there is we're about as opposite as you can be. So believe me, there's been a lot of compromising over the years. Anybody who's been married that long, it doesn't admit, yeah, you've had there bumps in the roads here and there, but
Right.
hey, just keep it going and get through them, right?
Exactly. Exactly. Try to appreciate those differences in some form.
Right.
Yeah. I hope we can have Pam on an upcoming show, and I know for sure we're going to have Brittany. She agrees to come on the show. Their perspective will be so valuable.
Great.
Yeah. So tell us about your upbringing, because I know your mother and other family members had quite a significant impact on really what brought you to where you are today.
Yeah, well, my father was an old country doctor in Kentucky. He actually made a lot of house calls, would even do some house calls on horseback into the hollers of Kentucky. And he got rewarded not unfrequently with eggs and chickens, etc., not money.
Yes.
And he was in World War II. He was a flight surgeon stationed over in England when all the bombing was going on there. He never really liked to talk about that much because it was hard. He knew when he'd send those pilots off, it'd be lucky if half of them made it back from their bombing mission. But he was a well-respected family practice. Like back then, they didn't call him family practice. He was just a general doctor. I mean, he did surgeries too, like appendix, etc.
Yeah.
And he was the chief of staff for the hospital that they eventually built in Elizabethtown, Kentucky. So he was instrumental in getting the hospital in that town, which has now gotten pretty big, but back then it was a small little town, E-Town, Elizabethtown, Kentucky. And then my mother was a poet. She became a poet laureate for the state of Kentucky. She organized a poetry magazine, and she did a lot of volunteer work. She was president of the state American Heart Association for quite a few years, involved in the Board of Higher Education. So I was exposed to a lot of intellect, so to speak, as I was growing up. Mm-hmm. And they all wanted to do humanitarian volunteer type work. So, and then I had 5 brothers and sisters. So, still 4 of them are still alive. I've lost one sister several years ago to skin cancer, actually. But yeah, so a lot of siblings, and I think I was blessed with my parents. And I was always raised being told that anything you want to do, you can do. Anything you put your mind to, you can get it done. So I was never, no limitations were ever placed on me. My father was good that way too. He believed, hey, let nature take its course. So it would be extremely rare when they would tell me I couldn't do something. It's like, yeah, even if they felt it might not go so well, it's like, let them go do it anyway. If it doesn't go so well, we'll learn. Sometimes the best way to learn is the hard way. So I think I was fortunate.
You were very fortunate. That sounds wonderful.
Yeah.
Great. Well, one more thing I'd like to talk about from your past, because it's another question that I get asked a lot, and then we'll delve into the method a little bit more. And that is the fact that it is quite divine, it's providence, whatever you want to call it, that you are even still with us today, because you were quite adventuresome, to say the least, when you were younger. Still are, I would say. But I been with you enough. Fortunately, I really appreciate the time that I was able to spend with you there in Gallatin, seeing patients, and now, and just getting the message out about the BaleDoneen Method. But I've loved every story that I've heard from you about your past. They're all so entertaining and just unbelievable. You've had some great experiences. So I just wondered if there's a few stories from your past about some of your adventures that our listeners would enjoy hearing. I know if whichever ones you want to tell, they'll enjoy hearing them.
Yeah, well, no, I am fortunate to be alive, and I think there probably was divine intervention, and I always wondered why I didn't die during some of these adventures I would take on. I think it probably is because of this heart attack and stroke prevention method that we were able to develop. But yeah, I basically lived my life with no fear. So went to college in Wisconsin, and I would do whitewater rafting there. And one time I held my breath as long as I could, and I just figured, well, I'm going to die, I'm going to drown. And boom, I popped up. I got caught fell right out of the raft at the start of the rapid, and it was in a canyon. So that was one. And then the next year I'd go skydiving, and back then you took off on a cornfield. It wasn't even a paved landing strip, and the plane didn't even have a door on it. So once you got up in the air, you literally felt like, hey, it's safer to jump out of this thing and be in it when they landed. But they gave us reject World War II chutes, so they weren't the best chutes. And one of those days I got caught in a downdraft. It was Wisconsin. It's cold and the air was heavy. And my jump master said, wow, you look like you landed perfectly. Well, I broke my leg, my left leg, tibia and fibula. So I had to have a rod put through that, but survived it. And I should have known better, because the person who jumped before me, his chute didn't open. He had a reserve chute, but by the time he got that open, he was way off the drop zone. He ended up hitting the barn. He goes through the roof of the barn. He hits a hayloft, and then he goes through that and lands on the ground. All he did was break his ankle.
Oh, my word.
That was a person that jumped before me. That should have told me something. And then when I got to Spokane, Washington, after I finished medical school, at that time, I didn't know how to ski because I was raised in Kentucky. But I saw on TV this helicopter skiing, and I thought, wow, that just looks fantastic. It was a brand new sport at that time. This is 1974. So Mount Spokane was lit at night, so I could work during the day seeing patients. And then we didn't have children back then, so I'd head up to the mountain and learned how to ski in the dark, broke some ribs and hit trees, made myself ski through the trees. And so the next year I thought I was good enough to go, right? So there was an operation just starting out of Nelson, British Columbia. So I'd go up there to do this helicopter skiing, and I wasn't ready at all. I mean, every other turn I was falling, having to get up in that deep snow was hard, but I was in good shape and I had a good attitude. So at the end of the day, there were just two owners of it, and they just started it. One was Taddy Derbyshire. He was an ex-Air Force pilot for the Canadian Air Force. Currently, at that time, he was a pilot for Air Canada, would fly over to Hong Kong. The other owner was Gary Kilpatrick, and he was a tough guy. He was a great skier. He was the guide. He owned the local bar and the local hotel, and he was the hockey player they'd put in when they wanted to take a player out of the game. That was Gary. But Gary respected how much fun I was having, despite the fact I wasn't as horrible skier. So he invited me back to the hangar with the helicopter pilot. And after about a case of kokanee beer, Taddy comes in and they say, we just started this. We could use another partner. I just looked at him and said, well, I'm in. So I go home and tell Pam that. She about kills me. But so because it was early in the history, what would happen after that? Well, the first thing I did was take out a lot of life insurance. So that changed Pam's attitude right away. So then she'd watch the weather report and say, it looks like it's going to be good snow up there in British Columbia this weekend. Don't you want to go? I said, yeah. So I went up there a lot. And at the time, we were just building the business. So Gary and I would take a group up, get them familiar with the terrain, drop them off on top of the mountain, and then tell them, ski down to that lake. The helicopter will pick you up down there. And then Gary and I'd get back in the helicopter, and he'd tell the pilot, Doug, he said, no man's ever skied that mountain. Take us up there. No man's ever skied that mountain. Take us up there. And so it's all logged officially on the helicopter. So if you ski it first, it's yours. So we ended up, after 20 years, developing a helicopter ski operation that was twice as big as the most famous ones, the Monachees and the Bugaboos, with Canadian Mountain Holidays, and we butted right up against them. So they made us an offer we couldn't refuse. But I had about 20 years of helicopter skiing. I did lose a few friends in avalanches. I mean, it's a dangerous sport. Mm-hmm. It's so good that really after you make your first turn in that deep powder, it's like, hey, if today is my day to go, I'm happy to go. I mean, it's that good.
Wow.
So, but I always wondered why I didn't die, because I got caught in a few avalanches and never survived them. But I think maybe it was due to the BaleDoneen method.
Right. Yep. You had important work to do.
Yeah.
Mm-hmm.
But I think that knowing that probably also helps explain why we were able to move forward developing a method like we did. Because do you think I was worried about criticism or what somebody else thought? I mean, again, I had no fear. It's like,
right.
No, if this seems right, I'm going to go do it.
Yeah. Right. So that really did help formulate it takes somebody strong with that type of attitude to take the criticism all these years, for sure. And of course, you're starting to see the fruit of your labor. You've seen it on a personal level with your patients one-on-one, but now finally seeing more of a widespread use and acceptance. So.
Yeah.
Thank goodness. So congratulations on all your hard work. There's so many other stories, so maybe we'll do another show with others, but those are fantastic.
Some mountain climbing too.
Yeah. And I know you had an encounter with a bear at least once.
Oh yeah, I got to spend a whole week with Alaska brown bears. I won the Alaska lottery. So I told Pam I won the Alaskan lottery. Of course, she's getting all excited, wanting to go out and get a new car or something. I said, well, then wait a minute. Let me tell you what that is. It was a right to go into McNeil River in Alaska to spend a week in your backpack tent with about 250 Alaska brown bear. I said, it's actually going to cost us some money because I got to get up there. But that was an unbelievable week. You got to live with the bears for a week. They would wander right by your tent. And
wow.
there's so many salmon that are running at that time. That's a much more tasty food for them than a human. So the only time I almost got in trouble with that, I was sipping some bourbon at night. It never got dark, so I wanted to keep a journal. And that wasn't too smart. You're supposed to keep all your food in it. They had a log little cabin, but I had that in my tent because I wanted to have a little sip of bourbon at night. And I think the bear smelled it and he put his paw into my tent. I thought, oh. But I just looked at him and he looked at me, and we could tell neither one of us really wanted to get in a fight with each other. So he just wandered off.
Wow. Without the bourbon, he was okay not stealing.
Yeah, I can say, but I put it in the log cabin after that. Yeah.
Oh, wow. Oh, wow. That's amazing. So glad you're still with us.
Yeah, it's been great.
So tell me about the early days in the method. I know that, for one, we talked about your attitude and how you were not afraid to take on this this method, which at the beginning you didn't even know you had a method. You were just trying to, as you say, do the right thing. But one thing I know about you and Amy as well is that if it's not founded in the science, then it's not in the BaleDoneen method. And of course, that's one reason the BaleDoneen method is ever changing, because science is always coming out fresh and new. But back in the early days, when you and Amy began to appreciate the fact that we needed to evaluate the wall of the artery very carefully in order to pick up cardiovascular disease, atherosclerosis, the development of plaque in its very earliest stages, and that's when we could intervene. And then not only because we could save that person from ever having the first heart attack, but then people who were incredibly sick, who had had heart attacks, bypass surgery, etc., could still evaluate the wall of the artery and tell if you're making progress from year to year, regressing the disease. But nonetheless, I know in the early days there was coronary artery calcium score testing that came out. People were looking at ultrasound. Just tell us a little bit about some of the people that you spoke to at the time and the conversations you had, and how that's come today, where both of those tests are very valuable, but you were really in the trenches, if you will, when they were being evaluated.
Right. Yeah, no, so my base, of course, is family practice. Mm-hmm. So after being in family practice for 20 years, so this was about 1995, I had a big family practice. And back in those days, and hopefully it's still true, but maybe not as much, that your patients weren't just patients, they're really your friends. So you get to know them really well. So when something adverse happens to them, it hurts, just like it would hurt if a family member or friend had a problem. And I had my share of patients who would have heart attacks or have strokes. And with the heart attacks, I was doing conventional healthcare. So if they had presented with symptoms that sounded suspicious, I'd send them to the cardiologist. They'd put them on a treadmill, tell me, oh, they're fine. And then lo and behold, a week later, they were in the hospital with a heart attack, or some of them actually died. So I had 20 years of experience knowing that conventional medicine wasn't really doing a good job preventing the heart attacks, and my patients were suffering as a result. So I was very fortunate in Spokane, Washington. There was an excellent cardiologist, Dr. Paul Shields, and he's still alive, and he's really my main mentor for what we're doing. He was the first adult cardiologist to ever go to Spokane, Washington. He did some of the very first angiograms on humans, and he had a partner, Dr. Marcus DeWood, who's one of the most famous cardiologists in the world, because he published in the New England Journal of Medicine around 1985 that it's actually a blood clot that blocks the flow of blood, not the buildup of cholesterol in the wall, but a blood clot. Mm-hmm. And so Paul Shields was very aware of all that research and that publication. And he latched on to the brand new imaging technology of electron beam tomography, which was a technology that was so quick, even though the heart's always beating, it would freeze the heartbeat well enough you could get a clear image of the coronary arteries for calcification. So he purchased one of the first machines ever that could do coronary calcification testing. And I went to one of his talks and he said, well, you know, it's really pretty simple. If you do that test and they have calcium, it proves for sure they have disease in the wall of their coronary arteries. And now that we know it's a blood clot, not the buildup of cholesterol that blocks flow of blood, it makes sense to go ahead and treat that person. You know, get them on a statin and get them on antiplatelet therapy. So I started doing that, and it was just myself and really one other doctor in town utilizing that equipment, Dr. Fred Byron, who's also still alive. And we plan on getting Dr. Shields and Dr. Byron at our next BaleDoneen reunion, which is going to be in Spokane, September 20th, 21st. So it's going to be a historic event where we can honor these people. But Dr. Byron was one of the most respected internal medicine doctors in Spokane. I had tremendous respect for him. So even though all Dr. Paul Shields' cardiology colleagues were laughing at him for doing it, mocking him for doing it, they were making fun of me for doing it. But I knew the science was there to support it, that Dr. Shields also told me it was inflammation that causes disease. And I knew Dr. Byron was a huge believer in it and had the utmost respect for him, so I didn't get dissuaded. I kept offering this test to my patients, and I had enough of them do it that after about 5 years of that, I was able to look back on that pool of patients, which was well over 100 people. None of them had had a heart attack or a stroke. So I said, wow, you know, hey, maybe this really works. And then at that time, Amy Doneen was finishing up her nurse practice training and needed to do an internship with a medical provider. One of my nurses was good friends with Amy and told Amy, well, go see if you could work with Dr. Bale. So she came over. I was impressed right away with how bright she was and what a positive attitude she had. So I said, sure, yeah, you can do an internship with me. Well, she's so smart, it didn't take her long to realize what I'd been up to. And I had all this data collected with coronary calcification. And that was way in the early days of that. So she ended up gathering all that data together and doing her thesis on those patients with the basic purpose of the paper was to show, hey, it makes sense to go see if the patient has arterial disease and treat them if they do, as opposed to just looking at risk factors, like how old are they, what's their blood pressure, what's their cholesterol. This technique of actually looking for disease seems superior and makes a lot more sense. So she ended up doing her thesis on that. And she was hooked because she was so brilliant. All sorts of healthcare providers wanted her to go to work for them, in particular in the infertility field. So these other doctors were making her offers I couldn't make. I mean, I didn't have that much money, it's family practice. But she was so taken by the heart attack prevention and utilizing cutting edge science to work on this issue that she stuck with me. And then we went on and migrated to carotid IMT when the paper came out talking about that, and that was the year 2000. So that was 19 years ago. The American Heart Association's expert panel on prevention came out with a paper saying, hey, this carotid IMT test where you use ultrasound and look at the wall of the artery in the carotid seems to really make sense and be a good test. Well, Amy and I discussed it, and we said, yeah, you know, we've realized a problem with coronary calcification by that time is calcification is a sign of stabilization of the disease. So we realized we really can't follow our treatment by repeating the coronary calcification test. You want the score to go up. You want what wasn't calcified to get calcified. And so what's it mean when it goes up? You don't really know. So we also knew that if a person had all totally hot, dangerous disease in their coronary arteries, it may not have calcified at all yet. So you could have a 0 score and still have high risk. So the coronary calcification test is an excellent test, but it has weaknesses. One, you don't know for sure if they don't have disease if they have a 0 score. It could all be dangerous, just hadn't calcified yet. Two, you can't follow disease with it. So as wonderful as it is, we still use it some. It had its weaknesses. So we thought, well, with the ultrasound, it doesn't have to be calcified to know if it's there. So even if it's hot and dangerous, and just totally full of cholesterol and no calcium, you can still see it. And you should be able to repeat the test every year or so. And what's happening to the disease? Is it getting bigger? Is it shrinking? Is it getting calcified or not? Or they have new ones? So we thought, hey, this could be worth trying. So we identified a company in Salt Lake City, Cardio Risk, and they were very wise to bring on Dr. Gene Bond as their main medical director. Dr. Gene Bond is professor emeritus at Wake Forest University. He was doing research with carotid IMT testing on rhesus monkeys back in the 1980s. So he was a principal investigator of the human trial, the ERIC trial, that utilized carotid IMT. So he set the protocols, trained all their sonographers, and we started flying Cardio Risk up to Spokane, Washington from Salt Lake City once a month to start evaluating our patients, their carotid arteries. And after we did that for 1 year, we had over 100 of them, and the data was analyzed by a statistician, and it showed unequivocal regression of disease. Well, so this was like back in 2001, 2002. So Amy and I were, of course, extremely excited about that. And the data, because the protocols were so tight and Gene Bond stood behind all the training, it was reliable data. So we were invited to the International Society of Atherosclerosis meeting in Rome, Italy, to present that data, which we did. We went over to Rome and presented it, and it was the first time anybody had ever shown regression of arterial disease. So as powerful as it was, of course, there are a lot of skeptics out there thinking, well, there's something wrong, the data must have been bad, you can't do that, you can't regress disease. But so, well, it really looks like what's happened here. So that was a great thing that we did, because it made national and international news in the medical airways. And one person that saw that was Dr. Bob Salem. Well, Dr. Bob Salem was in Lubbock, Texas. He's a vascular surgeon. He trained with DeBakey. He was in on some of the very first heart transplants. he was in charge of 18 cardiologists. He was a medical director for him. So he contacts Amy and I and says, look, we've got a lot of heart attacks down here. We need you down here for prevention. So he came up to Spokane and started courting us. And he finally made an offer that I couldn't refuse. Amy did refuse it, which was fortunate because she kept the practice we had going in Spokane, and of course since has built it into a phenomenal practice with patients from all over the world. It's really amazing what she's done, but it was a blessing actually she didn't go to Lubbock, but it was a blessing I did, because with the support Bob Salem gave us, we were able to start our course where we could train other doctors and get it certified for medical education. So without Bob Salem's influence, we wouldn't be where we are now. And Pam and I had been in Spokane for, at that time, 30 years. We'd already raised our children. I'd taken advantage of the helicopter skiing, the mountain climbing, and whitewater rafting and all that. So it was okay to move to Texas. And we liked Texas, and I still go there. But then Pam was lonely for family and anxious for grandchildren, and made the guess that Brittany would give us our first. So she wanted to move to Tennessee, and with our method, I could go anywhere I wanted. So it really didn't matter where I lived. So I said, okay. So Pam was right. A year after we got there, we got the 2 twin granddaughters who are now 6. So.
Wow. And you still go back to Lubbock and see patients about 4 times a year? Is that right?
Well, I've had to curtail that. Usually it's twice a year. And as busy as our BaleDoneen method is getting, it probably going to, quite frankly, end up more like 1 time a year. And then I can visit with those patients over the phone, or they're welcome. Some of them come up to Nashville. I mean, it's a fun place to visit.
Right.
And see me in my office there. But I have a great number of wonderful patients in Lubbock, Texas. One of them is in the book. People read the book. Joe, he's the one that was told 12 years ago to stay alive, he had to have another person's heart put in his body. They wanted to do a transplant on him. Instead of that, he chose to plug into the BaleDoneen method. That was 12 years ago. He couldn't even take a step basically without nitroglycerin when I first saw him. He won the national dog trials with his own heart several years ago. He now enjoys horseback trips in the mountains of Colorado, going up over 12,000 feet without even needing oxygen or nitroglycerin. He's now 71, has his own heart in his body, and enjoys his grandchildren now, and looking forward to having more grandchildren. And so I don't think that would be the case if he'd had a heart transplant.
No. Or had not found the BaleDoneen method, regardless. Yeah.
So I've got wonderful patients in Lubbock, Texas, and very blessed to have them as supporters and patients. So, yeah.
Well, if hearing Joe's story doesn't prompt all of the listeners to want to seek out a BaleDoneen method provider, I don't know what will, because you've given us the example not only of Joe, who was a very sick individual, but also hundreds, if not thousands, of patients that you and Amy have seen together, and now other BaleDoneen providers like myself, picking up disease before you ever have that first problem. So just to recap on a couple of those points for the listeners, we're trying to change the conversation, right, Dr. Bale, with at social events or the cocktail hour or at work around the water cooler. Most people are used to, if the conversation turns to health, to talk about, hey, I passed my most recent stress test, or how's your cholesterol doing? And of course, talking about lifestyle issues. But we want that conversation to be, when was the last time you looked inside your body to see if your arteries are healthy, or if they're not as healthy as they could be, or if perhaps they're even quite diseased. That technology is so available and so inexpensive. Everyone needs to have that ultrasound test and possibly the coronary artery calcium score, depending on what is found.
Yeah, no, you're absolutely right. Yeah, we published a paper in a peer-reviewed cardiology journal in 2014. The title of that paper is "We Now Live in an Era Where You Can Guarantee Arterial Wellness."
Mm-hmm.
And that article is still being very well received and picking up steam all the time, even though we published it almost 5 years ago now. And the guarantee is possible because of two advancements in science from the time we first started treating heart attacks over 100 years ago. We didn't have the technology or knowledge that we now have, so we were forced to wait for somebody to prove they had disease in their artery by developing symptoms. Having chest pain, having a stroke, whatever. And then it's really miraculous what physicians were able to come up with to deal with that disastrous end-stage disease, such as transplants, artificial hearts, stents, bypass. But we live in a time now where that's not necessary anymore. We have the technology to go find disease in the wall of the artery long before a patient has to let us know about having symptoms.
Yes.
We don't need to have a heart attack or stroke to prove they got disease. We can go find it with these simple, inexpensive technologies. So that's one. The second key was the knowledge of what causes arterial disease, and that is its inflammation. And interestingly, that was first proposed 169 years ago by Dr. Virchow in Germany. He wrote a paper on that. And since that time, numerous other scientists proposed it, and including Dr. Paul Shields told me that was what caused arterial disease in 1974. But then we had absolute confirmation through big genetic studies about 4 years ago. Then the year after that, we had confirmation with imaging studies on living human beings confirming that it's inflammation that drives disease and triggers events. And yet, still a lot of medical colleagues thought, no, it's cholesterol that causes disease. Unbelievable. So finally, August 27th of 2017, they published in New England Journal of Medicine the CANTOS trial. And in that trial, they used a biological agent that prevented the formation of inflammation. It did nothing to cholesterol, zero to cholesterol. All the patients in the study had known terrible coronary artery disease. And the ones fortunate enough to get that biological agent had significant reduction in heart attack and stroke, despite the fact cholesterol didn't get impacted at all. Mm-hmm. So then it was absolutely accepted. It'd be hopefully hard to find any medical provider now that doesn't agree, yes, it's inflammation that causes arterial disease. So that controversy is over. But that was the foundation, along with evaluating people for disease, the foundation of our BaleDoneen method. So then the trick is, if you know it's inflammation that drives arterial disease, you have to know all the potential sources for that inflammation. Mm-hmm. And that demands a holistic approach to extinguish the fire in the artery, so to speak, because it's way beyond cholesterol and blood pressure and smoking. As a matter of fact, psychosocial issues rank third in importance in causing heart attacks, anxiety, depression, stress, sleep problems, low vitamin D, periodontal disease, endodontic disease, autoimmune diseases, insulin resistance, the prediabetes, the metabolic syndrome. Genetics play a big role, the gut microbiome, So you can evaluate an individual patient for all the potential sources for fire in the artery, and whatever isn't optimal, you can optimize it. Guess what happens? The fire goes out. And our bodies were made miraculously. We believe in God or whatever you believe in. Our bodies are miraculous. You extinguish the fire in the arteries, the body's made to heal it.
Hey.
So what happens? The cholesterol that was in that disease gets yanked out, and it gets replaced with collagen and calcium. And when that happens, it shrinks, because the cholesterol is real fluffy and fatty type stuff. So when you take that out and you replace it with dense calcium and collagen, that's why the disease regresses. It does shrink. And once that happens, the danger of it ever reaching a point where it's going to stimulate a blood clot is virtually eliminated. So, I mean, there's no mystery to it. Yeah. The science is there. It's just, it takes forever for conventional medicine to change.
Right.
You know, and we know in any field of science, from the time good science is published until it gets utilized, on average is 25 to 30 years. So we've been at this now about 20 to 25 years, and you are seeing more and more publications just backing up everything we've been saying for the last 2 decades.
Yes.
The science has been there, and now, fortunately, other people are finally catching up to it. But Amy and I will stay ahead of them anyway, because the genetics is what we utilize to do precision management. You have to know the genetics of an individual so you can be precise with your management, and that field's exploding. So we stay on top of that and all the new developments. Our method is dynamic, as effective as it's been for years. It just gets easier and easier, actually. It's just fun to watch the science. The scientists out there doing this research, I mean, they're amazing.
Yeah. A lot of incredible information coming out. You're right. I think it's important to note, you mentioned these dates, but it was early 2000s when the American Heart Association validated what you've just said. Let's go and look for disease. If it's there, let's find it. So that was early 2000. And in 2001 was when the landmark study came out, demonstrating the fact that if you look for disease and you find it in healthy individuals, these are not people you would think would have a heart attack or stroke, age 35 to 65, relatively young people, healthy, and you find a small area of plaque on the wall of the artery, not blocking the flow of blood, those individuals are 40% likely to have a heart attack or stroke in the next 10 years. 40%, far higher than any evaluation of their risk factors would indicate, right?
No, that's exactly right. That was a Cafes to Cave trial, which was an excellent trial. 10,000, quote, healthy people ranging in age from 30 to 65. And they did the ultrasound of the carotid, the ultrasound of the femoral artery as well, to look for disease in the wall of the artery. The caveat to get in the trial back then, and it was started in the 1980s. It wasn't published until 2001, but it was a 10-year trial. So if you wanted in that study, you had to sign on the dotted line. No matter what we found here with the ultrasound, I can't receive any treatment during the next 10 years until, or if I have a heart attack or stroke, then I'm a check mark in the study, then I can go get treated, but no treatment for 10 years. So you can't repeat that trial, because we now know we have medicines that will work on reducing the risk. In 1980, we didn't know if we had anything for sure, so they could do the trial. But you're exactly right. That trial showed if you just had even a little bit and not obstructing the flow of blood at all, disease in the carotid or the femoral, they had a 40% chance of ending up with a heart attack or stroke during the next 10 years. High risk in conventional medicine is classified as a 20% 10-year risk. This is double that.
Yeah.
Yeah, it's
Yeah.
amazing.
So if you haven't had the test and you don't know the health of your arteries, you know, all of our listeners need to go out and find that test, of a high quality test, which will be a topic of another show, but need to make sure that it's someone such as, you know, the Gene Bond days, cardio risk, et cetera, that adheres to high quality standards. But nonetheless, the protocol, if you will, or the thought process within the BaleDoneen method is to look inside the arteries using ultrasound, carotid. If that looks pretty good, go to the femorals. If that looks pretty good, no evidence of plaque, then we do look in other arterial beds, either the coronary artery calcium score, the arteries of the heart, or an aortogram looking at the big vessel going down the middle of the body with ultrasound or other technology. You can also, I just drew a blank. Oh, I know, the technology is now becoming available to directly visualize the arteries in the eye. So that's
Yeah,
the
right.
latest, greatest thing.
Yeah.
The artery is so small, I think it's really hard to pick it up in the earliest stages. Would that be correct? Late disease, we can certainly see there.
No, they have research. If you have computer assisted evaluation of the retinal vessels, you can detect very early stages of atherosclerosis, arterial disease. So I think you're absolutely right. The future very well may be we don't even need to look at the carotid, the femoral, or the coronaries. You can just have computer assisted images of the retinal vessels, and that'll tell you what's going on with atherosclerosis. I think we may be 5 years, 10 years away from that, but I think the future, that very well may be the way to go, because the retina, that's the only way we can directly look at arteries, and it's the only way we can directly look at the brain. Of course, you see the optic nerve, which is part of the brain. So the eyes are really the window peak into your whole arterial system and a window peak into the brain. So the eye is exciting. So I'm glad you brought that up. I think that is the future, and not that far into the future. So we may not need to do this carotid test or the femoral test or coronary calcification.
Mm-hmm.
Do the retina. Now, how exciting is that?
How exciting.
That's what I say. It just gets easier and easier to do this work.
Yeah.
It doesn't get harder. It gets easier. So, and to keep it real simple, you just need to find out if you have disease, and then you want to do the blood and urine tests, which aren't very many and they don't cost much, to make sure the artery is not inflamed, that it's cold. So if you keep the arteries cold, you're not going to have these heart attacks and strokes. And what we've observed in the last 20 years is you're also not likely to develop any dementia, Alzheimer's disease, heart failure, kidney failure. If you're a man and you don't have erectile dysfunction, hey, guess what? You're not going to get erectile dysfunction. Peripheral arterial disease. If you really want to have a high quality of life, you need to keep the 60,000 miles of vessels in your body cold. Keep your body good and hot and ready to go. But I tell you what, I don't want to be remiss and not bring up another very important individual in the BaleDoneen method. So we talked about Paul Shields, talked about Marcus DeWood, we talked about Bob Salem and Gene Bond, but another individual is Tom Neighbors. He's a dentist, and actually one of my patients who's an endodontist sent me an article that he clipped out with where Dr. Neighbors was being interviewed, and he had just brought to the United States of America DNA testing for pathogens, bugs in the mouth from periodontal disease. And he was talking about how these pathogens will cause inflammation in the arteries throughout the body. And now we have an accurate way to see what bugs are in your mouth with this DNA testing. So Amy and I talked about that. We were excited about it. And literally within a few weeks, we flew to Nashville, Tennessee. I wasn't living there at the time.
Mm-hmm.
Amy flew from Spokane. I flew from Texas. And we spent a fascinating day with Dr. Tom Neighbors, who educated the heck out of us on the oral systemic connection. He's a brilliant guy. And that really enhanced our method, because we soon realized after that that this oral systemic connection, periodontal pathogens, the high risk ones, are a very common cause of arterial inflammation. And so Dr. Neighbors is really one of our huge mentors and enhanced our method. And we're bringing him to Spokane, Washington for a reunion too, so we can honor him and have him give a bit of a presentation. But
oh, that's great. That's exactly where I was going. So glad that you talked about Dr. Neighbors. And of course, I want all the listeners to understand that the BaleDoneen method, Drs. Bradley Bale, Dr. Amy Doneen, were the first to say a cardiovascular disease prevention program that is effective must have a dental and a medical component. You have to have dental expertise and medical expertise with an integrated communication, collaborating together on the health of the patient, because there are so many issues occurring in the mouth that directly affect not only your risk of heart attack and stroke, but directly affect the atherosclerosis process. So I know we don't have a whole lot of time left, and we've got future shows that I'm very excited about where we'll go into this more in depth. Yeah. But we have to mention the article that you and Dr. Doneen and Dr. Vigorous published, showing the association, because that's a stretch for a lot of people. I go to the dentist when my tooth hurts, they might say, or when I need a cavity filled, or an occasional cleaning. That is scary. That's scary, scary, scary. Knowing what I know now, what I've learned from you and Dr. Doneen, the dental care is life-saving care, along with what we're providing on the medical side. But we know that these oral pathogens, these bugs, these bacteria that you've just talked about, directly affect what's happening in the wall of the artery. We could talk about Dr. Pessy's work. We could talk about numerous studies, but none brought it together more clearly than the atherogenic triad paper, or the response to retention paper, demonstrating how can something that's in my mouth affect my arterial system and my risk of heart attack and stroke. Maybe you want to elaborate on that for just a minute, very simply for our listeners to say there's no doubt.
Yeah. Well, at the time we were working on the paper, the American Heart Association had actually done a huge review of the literature and concluded that periodontal disease is independently associated with arterial disease with level A evidence. That was a huge statement, because independent means it's still related to arterial disease after you adjust for everything you can think of, like how much do you weigh, what's your blood pressure, what's your cholesterol, et cetera, et cetera. It still was associated. And level A evidence is extremely hard to garner in medicine. It takes numerous randomized, double-blind, placebo-controlled trials in similar populations reaching the same conclusion. So it was actually a huge statement. But the one thing that everybody focused on was it just said associated with arterial disease, not causative. There's a big difference. If it's associated, well, you don't know for sure if you take care of that problem, is it really going to impact the arterial disease? If you know something's causal, you know if you take care of that problem, it will impact that end stage disease. Mm-hmm. So we published a paper based on there are 3 accepted elements that are necessary to form disease in the wall of the artery. And in this paper, we were able to scientifically prove how these high-risk periodontal pathogens enhance each of those 3 elements. So they affect all 3 of them, and they affect them in an adverse manner to drive arterial disease. So the only conclusion you can make when that's the case is that it is causal. So it was published in Postgraduate Medicine. It's a landmark trial, the first one to show that high-risk periodontal pathogens are a contributory cause of arterial disease. That's a huge difference than just being associated.
Mm-hmm.
So when it's causal, it demands action. You have to take care of it for sure. So the way we like to do an analogy of it is with like driving under the influence. I think everybody listening to this would agree. There will be some accidents today driving under the influence. That's the cause.
Mm-hmm.
There'll also be accidents today that have nothing to do with driving under the influence. Mm-hmm. And some people will drive under the influence and they'll get away with it. They won't have an accident.
Right.
Knowing those latter two facts, you don't go back to the first one then and say, oh, well, even though it's going to cause some accidents today, we don't need to worry about it. What? You kidding? Of course you need to worry about it. You need to deal with it. You need to pass laws against it. And we think there need to be laws against high-risk periodontal pathogens because they are causing arterial disease. So,
yes.
But it was great to get that publication out there, and Postgraduate Medicine is a respected peer-reviewed medical journal. So, yeah.
Yeah, excellent. So that and other reasons, of course, we have as many dental colleagues on our upcoming schedule for shows as we do medical colleagues, because it takes them both. There are sleep issues, airway resistance issues, bite issues, so many issues surrounding the dental care, the oral, the physician of the mouth, for example, our dental colleagues are key. As you say, we cannot guarantee that our patients will live a life free of heart attack and stroke without our dental colleagues.
Yeah, absolutely. Yeah, no question about it. And it really takes you have to have a team of healthcare providers ready to assist with the patient's care. So the dentists and the hygienists, of course, are the ones that really usually go in and clean up the periodontal disease. So the hygienists, but they need a dentist who's supportive, but they really do the hard work. Right. And even the receptionist, the dental assistant, they all need to be on board and understand the importance of their work. They're not just saving smiles, they're saving lives, for sure. And I have to tell you this because it's on my mind, because for the first time I was asked to do a talk about how our method can impact men's health in particular. Mm-hmm. So I'm getting ready to do a fresh talk on that at this Hinman Dental meeting coming up. Mm-hmm. And there's unequivocal evidence that like periodontal disease is related to erectile dysfunction. Lots of other things are too, including sleep, vitamin D, etc. Basically, everything that we address to keep the arteries well is also going to enhance the chance of maintaining good erectile function. But men, if they want to keep it up, they need to stay up with their dental appointments. For sure. Right? A lot of people don't understand that. But the dental care is absolutely critical to maintain overall wellness. And of course, we know there's links with the high-risk periodontal pathogens with Alzheimer's disease. And Alzheimer's disease is linked to lots of other things too, like sleep, vitamin D, etc. But that oral care is absolutely critical. So that's critical. But we frequently also need personal trainers. Mm-hmm. Help our patients get the physical activity that they really need to combat some of these issues. We need psychologists to help us with the depression, the anxiety, the stress. We need dietitians. We need nutritionalists. So it really takes us a whole huge team of healthcare providers. Amy and I are not crazy enough to think we can do it by ourselves. We need help. We're happy to reach for it anytime we need it.
Takes a team, and everyone is welcome, as you say, at the table, because it's going to take us all to take this number one killer off the number one spot.
Yeah. Well, we do believe in 2022, they're going to report heart attacks are no longer the biggest killer. And that means that that'll actually be the case at the end of 2020. But the statistics lag 2 years behind.
Mm-hmm.
So if heart attacks aren't the biggest killer in 2020, which we believe will be the case, not just due to our efforts, but we think our efforts will have played a significant role in it.
Oh, yeah.
We think they're coming off in 2020, but you won't hear about it until 2022.
Wow. Well, along those same lines, as you know, in the BaleDoneen Method, not only are we encouraging everyone listening to this to have an evaluation, so click the link below to stay connected and to find a provider, whether you're a healthcare provider or not, because all of us as healthcare providers need the workup just, on ourselves first to stay healthy, to take care of our patients. But then all of our colleagues interested in incorporating this into our practice, our goal is to get to 10,000 medical teams and 10,000 dental teams as quickly as possible, implementing the BaleDoneen Method in a comprehensive way. So I encourage all of the healthcare providers to also stay connected. And all of that information is accompanying this show. We have several exciting shows with you coming up, Dr. Bale, and I can't wait to take a deeper dive into the method with you. We've sort of given a really nice overview. We also have more things we want to know about Dr. Bale, and one thing we didn't get to today, and we won't have time, but it'll be a topic of a future show, is that you are an inspiration to us all in so many ways, but none the most important thing is that you are the most committed person to exercise of anybody on the planet. I would challenge anybody to say they are more committed to exercise than you, and not just exercise, but really a holistic lifestyle. So I want to take that topic in a future conversation, but thank you for being an inspiration to us all with your dedication to practice what you preach. No doubt. I've been in your home, and I've known you for a long time now, and I just know that to be true. That if you have to walk in the airport to get your exercise in with your backpack on,
right, get her done. Yeah, but I would like to just end, I guess, with one other thought going through my head right now, and I know I've got two very important women in my life that are smiling from above right now. And were a huge influence in why I went down this path in the first place. Mm-hmm. One is my father's mother, Mama, mm-hmm. and my younger brother, Philip, and I were having lunch with her. I was 5 years old. Philip was 3. It was just the three of us. She was 65 years old at the time. We're sitting down for lunch. She has a massive heart attack. Mm. I remember the ambulance coming up the back alley to pick her up, took her to the hospital, and my father was the prominent doctor in town. There was nothing he could do, so he stood by and watched her die over the next 24 hours. Mm. So I know she's happy with what we've been able to accomplish in this regard. And then my mother, because she had a heart attack. We actually flew her to Spokane. She had bypass, did well for quite a while after that. She did have a slight stroke and ended up dying of heart failure, but it was due to coronary disease is what. She lived to 89, so she had a good life, but I know she's happy now too with what we've been able to do with the BaleDoneen Method. So I have those two powerful people up there.
Oh, Dr. Bale, I'm so glad you ended with those stories, because that is at the crux of what we do and why we do what we do, right? You and I and everyone listening, we have big plans. We have things we want to do with our family. We have things we want to do athletically. We have things that we want to accomplish, whether it's philanthropic work or mission work, or just take the kids to Disneyland or take the kids on a trip, whatever it is, right? It's important to us. And we will not rest until we ensure that every individual is given the opportunity to live out that life without a heart attack or stroke getting in the way. Because thanks to your work and Dr. Doneen's work, as you've said, the technology is there. We have the capabilities now. So, you know, I'm so glad you ended with those stories. It brings us back to why we do what we do, and those that have gone before us that have been robbed of what they wanted to do because they didn't have this type of care.
Yeah. Right.
Mm-hmm.
So I feel blessed.
Great. I do too. Thank you
Okay.
so much for your time today, Dr. Bale, and all of your insight.
Thank you. Thanks for all your help.
Okay. I appreciate it. All right. We'll sign off for today and stay tuned for upcoming episodes with Dr. Bradley Bale.
Okay. Thanks, Gene.
Mm-hmm. Bye-bye.